Hey guys, this is Trevor Wicken from medxcoach.com. We're starting a new series. You guys just went through the knee series, and now we're going to be going through a series on what's called Lumbo-Pelvic hip complex dysfunction, or low back and hip problems. Okay, we got a special guest for us for this series. This is John Strauch. He's actually my father-in-law, which is going to be awesome. He's actually been struggling for 7 months with low back pain. So he's got some kind of some degenerative arthritis stuff at L5, which is your lowest lumbar spine, and then he's actually got kind of a herniation, bulging thing going on at L3, which is two vertebrae up above that L5 level. So anybody that's got disc problems, low back, degenerative joint disorder, degenerative disc disease, if you've ever heard that, or sciatica, this program is going to be awesome for you. So the first thing that we're going to do, we're going to go over 4 foam roller exercises. It's going to help him. The first one we're going to roll over on, we're going to do the front of the leg. Then we're going to go the upper part of the leg up here called your TFL. Then we're going to go the inside of your leg. And then we're going to go mid-back. Okay? So first thing we're going to do is work this rectus femoris muscle here. So John's going to go ahead and turn over on his belly. Okay? He's going to be focusing on getting right through the center of the leg. Now this backside leg is going to be pulled out, kind of like you're calling like an army soldier. His back's going to stay nice and flat. His belly's going to be pulled up, so a slight pull up with the belly button to make sure that you're engaging those abs. So you do turn this into kind of a plank, and you want to make sure that the shoulder is directly over the elbow. Okay? So what he's going to do is he's going to kind of roll up and down. So kind of roll up and down for me, John. He's going to kind of roll up and down until he finds a spot that's very tender. Once he finds that tender spot, he's just going to hang out there for like a 30 count. So he can kind of in his head be like 1, 1,000, 2, 1,000, go to about 30 seconds. Then he's going to kind of roll again. Okay, so let's say that was 30 seconds. He's going to kind of roll around again. When he finds another sensitive spot, he's going to do another 30 seconds to 60 seconds. Now the key on this is to make sure that you don't move until that tenderness kind of subsides. So you don't want to just get 30 seconds and you're like, well, that's good, I'm good. You actually want to feel, you're going to feel a tender spot, and you'll actually feel that release. And that means that muscle or that nerve has calmed down, the muscle's calmed down, and that muscle is actually lengthened, which is going to help add more mobility through your spine or in your pelvis. Okay? All right, so the second one we're going to do is we're going to work on what's called your TFL muscle. So he's going to come up on his side through here, on the left side facing the camera. So he's going to lie on his side on the roller. The bottom leg is going to be straight. The top leg is going to be over the top. He's going to use this hand and these hands to kind of balance his body and provide stability. Again, abs pulled in. And then what he's going to do is right here in that hip, right along where that gun holster would be, I like to say, there's going to be some tender spots. So kind of roll up and down for me, John. He's going to find this spot. And as you guys can see, he's not 21 years old, so this is possible. He's had disc problems, so obviously, like, this should be painful, but it's not. So this is a good series of exercises to do, even if you've had back pain. I've had a lot of people be like, well, is it going to hurt my back? Is it going to do this? Obviously not, because he's got a pretty significant change in his spine, and he's killing this, so he's doing really well. Okay, so let's go ahead and move around again a little bit. Perfect. Is that another spot? Mm-hmm. Does it feel awesome?
Yeah.
Oh, yeah. What a way to spend a Saturday, huh?
Absolutely. Can't think of anything better to do.
That's right. Okay, so again, 30 seconds per side, and when he's done with that, he's going to just take a nice and relax. Okay, so go ahead and relax for me. So, now his shoulders, he was saying just earlier that his shoulders get a little bit tired doing this. So just take a set, kind of shake your arms out, rest them, because if you're not used to holding your body weight up, that's a lot of time to hold yourself up like that, okay? So you will be working some shoulders, which is good, and you will be working some core, which is good. But if you start to get tired, give yourself a break, hang out, power lounge a little bit, and then come back and do this, okay? So the next one he's going to do is he's going to do the adductors, okay? So you're going to lie down, this leg's going to kick out to the side, this one's going to be straight on your belly. Okay, so go ahead and lie on your back, on your stomach, on the floor. So the key thing is that he rolled to his side like this and then put his leg on the mat. You don't want to try and like just schlep your leg over the top of this thing, or you could cause an arching in your back. Okay, so get up on your elbow. Okay, and what he's going to do is going to kind of roll in and out and find a spot in what are called your adductors or your inner thigh muscles to really get that adhesion out of that inner thigh. Because what will happen is that if you get a lot of tightness through here, it'll pull your leg to the inside, And what that does is it deactivates your gluteal muscles up here. It further tightens up these hip flexors, pulls your pelvis forward, and nails that low back. Okay? So you want to get as much range of motion and movement in your hips and your legs as possible so that you can get your pelvis to come back, and then that'll help your spine stabilize because your glutes are turned back on. How's that feeling, John?
Yep.
Yeah, yep. All right. So that's his second spot. We're going to hold that for about 30 seconds. Okay? All right, so let's switch to your favorite. Okay?
Yay!
This next one is to get more mobility in what's called your thoracic spine, which is that mid-back. So a lot of times when we have back injuries, I've been talking a lot about that forward tilt. We see your pelvis pointed forward like this, and then a lot of times what will happen is people will just kind of start to fall forward because they're trying to protect their back. So you don't see people with healthy spines walking nice and tall. They're usually kind of bent over like, oh God, when is this going to hurt? Okay? So you get really tight up here in your chest, and you get really weak in that mid-back. So what this is going to do is it's going to release a lot of these muscle spasms in your mid-back, and he's going to open up and really get a lot more range of motion up top. Okay? So let's go ahead and bend your knees and put your feet flat. Now, key thing on this, because if you have low back problems, as you do this, you want to make sure that your belly button is just gently pulled towards your spine. So you don't have to crush it and pull that in or suck in your abs like that. It's just a gentle pull in with your navel or your belly button towards your spine. Okay? So what John's going to do is go ahead and just put your hands lightly behind his head. Okay? Abs are down, and what he's going to do is just slightly lean back, so let himself fold over the top of the roller. Okay? Let those elbows slightly fall. You're going to hold it for a 1, 2, 3, and then come back up. So his elbows come back in, he crunches up just a little bit, and then come back down. Okay, so go ahead and go again. So what this is doing again is creating more extension in this thoracic region up here so we don't have those rounded shoulders that cause that back pain to be able to stay. Okay, come back up. Good. And come back down. And he's even turning this into a crunch exercise. So he's got like 6-minute abs, man. Good. 3, 2, 1. And go ahead and relax. So you're going to want to do about 5 reps of that, about 3-second holds. Okay? So that's the first series, guys. Come back again. We're going to be rocking out with John on strengthening and lengthening on this next video. Thank you.